Thank you very much, Minister. At this point, we'll take questions. Is there any questions?
Thank you, DG. There are no questions on our side.
Okay. Yes, behind. Yes, you can proceed.
Good morning, Minister.
Ma'am.
I just wanted to ask this question on the issue of the Beitbridge border post. Sorry, firstly, this is Mangoba from ENCA.
I cannot hear. I'm sure. Yes.
Mangoba Mkunu from ENCA.
Yes,
And
but you must
use the mic.
Can you hear me now?
Yes.
Okay. Minister, on the issue of the Beitbridge border post chaos that you saw last week, I think you have made it quite clear in your statement and given us the numbers in terms of what really transpired there. But what we're getting, the sense that we're getting is that government is saying that we are not at all to blame for the chaos that happened there. In fact, it was, more than anything, an issue of logistics. So who is the minister saying should take the blame for this? Are you saying that it's actually the freight industry that should be held accountable for this? And then secondly, in terms of the issue of going back, you indicated that you're expecting these volumes to pick up. I mean, are you confident that we won't see the chaos that you saw at the border this time around with the plan that you say you've presented and that has been approved by the Command Council?
Thank you. Is that all? I think, Minister, you were very clear. That's the only question. There is one. Thanks.
Thank you, DG. We do have two questions. The first one is from Alex Mitchley from News 24. They have asked, what was the cause of death for the truck drivers on the 23rd of December, as well as those who died earlier this month? We have another question from Patrick O'Leary from Fleetwatch Truck Magazine to Minister Motsoaledi. You have referred to past statements by the various associations as propaganda. This implies an adversarial them and us scenario. Is there a willingness by government for all affected parties to link hands and to work together to avoid what we may have seen? To avoid what we may have seen, not only recently at Beitbridge, but also previously at Libombo border post and others. Also, you made no mention of COVID-19. Thank you. You made no mention of COVID-19 testing procedures, which were not in place last year, having an impact on traffic congestion at Beitbridge. What effect did the COVID-19 test procedure have on the holdups? Were the test systems and personnel sufficient to handle the traffic volumes? And I think that's
it
for now.
Okay, I think Minister can respond to quite a few. We'll take another round here.
The first question is whether we are blaming only truck drivers and the state takes no responsibility. I was not trying to apportion blame to anybody. I was just mentioning the facts because I said we need to know what happened if we are to avoid it. Of course, on the side of the state is that when truck drivers left their holding areas, there were no traffic officials to shepherd them back for that day. Yes, that's where the state has gone wrong. And the reasons are that traffic officials who used to do this work and who did it in November thought now they've established a clear method of dealing with congestion there. And they were deployed elsewhere. As you are aware, it was during the time of the year when we were expecting lots of accidents and fatalities on the road, and traffic officials went there. By the time we realized that we need them back and call them in, of course, it was after many hours. They did come back, and the situation was so bad that we even have to call the army. And they deployed 36 soldiers to help. And the DG, Mr. Makode, was there all the time trying to see. Some of the trucks broke on the road. And of course, I accept blame for the state there, because it took a long time to get the huge trucks from the army to come and pull them away. Because some of the truck drivers claim that their trucks have actually broken the road. And we are not convinced that some of them were broken. They just wanted to park there. And so there is blame on both sides of the state. But here, I was just mentioning that we wouldn't have had to have this disaster if people did not leave the holding areas. Now, of course, we have learned a lesson that we should not believe that once we establish a process with the truck industry, we must believe then they will follow it forever. They've shown us that they need to be policed continuously. Every minute, that there must always be traffic police, maybe even the army. It's not something that we thought should be necessary, but it looks to be necessary at the present moment. Whether we are confident that there will be no chaos, yes, we are, but only if people stick to their plans. If any other of the stakeholders does not stick to the plans again, what we saw might actually happen again. I mean, if a huge truck or many huge trucks just come and block 2 lanes and even block the incoming lane before you know what's happening, there will be chaos. But we are hoping this will not be allowed to happen, because now, after seeing what has happened, we'll make sure that officials are there to make sure that people stick to the protocols as they happen normally. The cause of death for the truck driver on the 24th, unfortunately, we won't be able to do that. It is inconceivable to stand up in public and talk about the cause of death of somebody without the family disclosing it. I'm sure you are aware that that's normal practice in terms of the National Health Act. I happen to have been in health. I know that very well. You don't stand up in public and blare up and say so-and-so died of this, so-and-so died of that, unless the family themselves do so. And the cause of death of other people, as I said, we do have their names and we do know fairly what has happened, but we cannot be in a position to disclose that, as I said, for obvious reasons. Now, the willingness of government to work together, that's of course what we are calling for. We are always willing to work together. When I went to Beitbridge in November, we were calling for this cooperation. There was this type of chaos in November when we rushed there. We rushed because there was chaos. It was not a peak holiday season, but there were chaos because once again, truck drivers at that time left their holding areas and went into the road and parked there. Immediately when they heard that there is a hold up in Botswana. And that's why I rushed there. And there was no way we could have solved it without cooperation. Yes, we are calling for cooperation. Everybody must play their role. Everybody must play their part and not just say, no, I will do this, the state will do that. It's like the fight against COVID. We are calling for cooperation with everybody. There are people who believe only the state must stop COVID. They don't have to put on masks, they don't have to sanitize, they don't have to do anything. So the same as at the borders, people must know that everybody has got a responsibility. And more than all the other people, the trucking industry, because congestion happens more often due to trucks rather than due to human beings, as I've given you the figures here, that there were much, much fewer human beings at Beitbridge than there was in the previous years. Now, the truck industry, including the message I've received here, was blaming the COVID protocols, the test procedures for the congestion, and they say the minister is not mentioning it. I'll tell you why. When there was congestion, massive congestion in Beitbridge in November, there was no testing from truck drivers. We've never demanded it. It was not there. But there was congestion, which caused the whole minister to go there And of course, my counterpart from Zimbabwe also flew down. We met there. It was about truckers leaving the holding areas. It was not about testing procedures because they were not there. So when the same situation takes place again, we cannot say, no, it's the testing procedures, because we have seen it before when people leave the holding areas. And if I'm not mistaken, if my memory serves me very well, it will have been for the third time that holding areas are left and it leads into congestion. I still remember the other time, but I forgot the date. So it is not the testing. And as I've said, anyway, we've asked the Minister of Health not to require testing for truck drivers, but will definitely require testing for all the other individuals, the other travelers who are traveling in cars and pedestrians walking on foot, etc., will definitely require testing from them. So we do not believe that the testing should be abandoned as it is being claimed, because we are here balancing between the free flow of traffic but the safety of people who still want to live. And I think the travelers also still want to live. Thank you very much.
I think we'll entertain one more last round. We can then relieve the minister. I think we'll take one last round. Mangoba, you are covering for everybody. Okay.
Okay. Minister, I just want to deal with the issue of the curfew and the airlines. That now the curfew has been adjusted. And it's coming at a great cost, of course, to many of those companies, those airlines that, of course, were operating at hours that were outside of this curfew before. So is government looking at adjusting this for airlines to still fly late, or do you have to stick to the rescheduling of flights?
Okay. I think that's the... Is there a question? Okay. Matigwen? Yeah.
Thank you, DG. We have 5 questions.
5?
Yes.
Okay.
Okay. The first one is from Alex Mitchley. Oh, no, excuse me. We already read that question. The first one is from Bongiwe Zwane from Newsroom Africa. They've asked, "Hi, Minister Motsoaledi, as much as it's one truck driver who has died at the Beitbridge border post, can you admit that the issues there require urgent attention? We are heading towards an influx of people coming back into the country. Have you beefed up personnel to ensure that the chaos at the border post is avoided?" And the next one is from Angelo Copella from CGTN. "When are you planning to meet with the road freight associations to iron out your differences?" The next one is from Nazir Mohammed, from Glow TV. "Are there extra checks being taken for all traveling from from European countries entering South Africa, given the high rates of COVID-19 cases there?" The next one is from Vickersberger from Netvac24. "Minister, can you give an indication of the volume of international flights arriving in and leaving the country? Which airports has the most traffic? Can you please give statistics on how many flights are arriving and leaving the country? Also, please indicate which countries have closed their borders for South Africa. Have we closed our borders for any countries? If so, which countries?" The next one is from Noma Bolani from from SABC News. Would it be suitable to consider a joint press briefing with all stakeholders, especially health, to avoid blaming other departments' inconsistencies, can you please share your understanding regarding what it means that that a traveller without a 72 PCR certificate will be allowed at their cost to take an antigen rapid test? Thank you.
The last question, can I what?
Oh, would it be suitable to consider a joint press briefing with all stakeholders, especially the Department of Health, to avoid blaming other departments? And can you please share your understanding regarding what it means that a traveller without a 72-hour certificate will be allowed at their cost to take an antigen rapid test?
Thank you. I think this is the last round, and I think Minister will cover most of the questions. Thank you.
Yeah, the first question about rescheduling of flights. Let me explain the role of various departments. The Department of Home Affairs is responsible for declaring an area as a port of entry. That means as to whether an area is going to be a border area through which people come into the country. That is declared by the Minister of Home Affairs. Whether it's an airport or a seaport or a land port of entry, the Minister of Home Affairs will declare that area. And once it's declared, other government departments have got their very important roles. The role of Home Affairs is just to make sure that people coming in through that gate have got requisite documents. Usually it's a passport and a visa. That's the only thing that Home Affairs check. All the others are done by the other departments. Like the issue of rescheduling of flights is an area of the Ministry of Transport. With all the other organizations like AXA and all that, which report to the Ministry of Transport, not the Department of Home Affairs. Whether a plane arrives at whatever time or whether it leaves, all that Home Affairs is interested in is to see, are the people inside that plane, when they emerge from the plane and get into the country, are they allowed to, in terms of a passport, a valid passport, machine-readable passport, and a valid visa if he comes from a country where a visa is required. The issue of COVID-19 is done by Port Health. Home Affairs officials are not trained to understand PCR certificates and antigen tests. It's done by Port Health officials. So I just want to clear that. So the rescheduling of flights because of the curfew will be determined and be known by the Minister of Transport. Bongiwe Zwani from Newsroom Africa. Whether we have urgently beefed up personnel, I thought I've actually mentioned. I don't know whether I need to repeat it. I've mentioned the personnel in numbers from health, from the Home Affairs, from the army, from the police. I've actually mentioned them. I'm sure Bongiwe must just check my speech to see that we have actually mentioned the beefing up of numbers at the borders, and I've even mentioned the borders, which are very busy where that will be done. A question from Angelo, whether we plan to meet with the Road Freight Association. Yes, I did ask the Minister of Transport, because the Road Freight Associations are also entities that do not report to Home Affairs, but to the Department of Transport. Home Affairs is linked at the hip with Road Freight Association when they start going through our ports of entry. That's all. Otherwise, all the other things, because remember that freight associations are not only truckers that go through the borders. Even inside the country, trucks do work and they are licensed and all that. And so that is done by the Ministry of Transport. Then I have asked that he organize a meeting for us so that we see how we work together at the borders. extra checks for all travelers from Europe. We have been doing this. It's not new. When we went down to lock level 1, from the 1st of October, we were doing checks. We said nobody is going to enter the country without a valid COVID-19 certificate, whether they are from Europe or ever. And if you may remember, we even had a list of some 26 countries where we were not allowing ordinary travelers, except a certain category of travelers, to come into South Africa. And we said even those who were allowed from those countries cannot come in without a valid COVID-19 certificate, which is not more than 72 hours old. We have been doing that, and we are just continuing with it. Eventually, we no longer red-listed countries as we did. We said everybody is allowed in South Africa, but there must be a valid COVID-19 certificate. And so I'm emphasizing, whether it's from Europe and from any other country, we actually demand such a certificate, as we have been doing from the 1st of October. We have never changed that, and we are still going to go on with it. From News 24, these are statistics that we don't keep in the Department of Home. We don't have at hand, but we can get them. The volume of international flights, as I said, it will easily be provided by AXA, because they are the ones who allow those flights to come in, and parking space and all that. They are the ones who allow the scheduling. So as to how many flights are arriving, we can get that information, but it's not something that is readily available. That we do have on our fingerprints, because it's not something that we deal with every day. Have we closed any border for any country? No, we haven't. And I think Minister Dlamini Zuma yesterday actually emphasized that borders are not closed. The only borders which we closed are the ones we closed at the beginning of the lockdown, if you remember. Out of the 8 airports in the country, 3 were functioning from the beginning of the lockdown, and Dr. Dlamini Zuma announced that those 3 will still be functioning. Sorry, excuse me, not 8, 11. Out of 11 international airports in the country, 3 have been functioning, and they'll remain functioning, as you know. The 8 are not airports, are seaports. All of them are open for cargo, not for human, for passengers, no, but for cargo. And they've all been opened, all of them, when we went to lockdown level 1. The land border post, as you might have heard before, were 72 in number. Out of that 72 land border post, excuse me, there were 53. 72 is the total ports of entry in the country, the seaports, the airports, and the land ports. The land ports are 53. Out of 53, we closed down 35 at the beginning of the lockdown and remain with only 18 border posts that have been functioning. So every country has got a border post that is functioning. We didn't close to any country, etc. We just closed the certain border posts. And why did we close them? Number one, there was no economic activity in those border posts. Number two, they did not have all the other departments like SARS, like agriculture, like health. When you go to them, you just used to find only 1 or 2 Home Affairs officials or police, at most, a police personnel standing there. So that's why we closed them. But since we opened Sunny Pass between us and Lesotho, between KwaZulu-Natal and Lesotho, it was opened subsequently. And I'm just announcing that on New Year's Day, we'll open Kosi Bay. So it will be a total of 20 border posts out of 53 that are functioning. The others will remain closed. But there's no country that could say all their borders have been closed into South Africa. The last question is very tricky. My understanding of what it means for a traveler to take an antigen test. My understanding is that every traveler plans to travel unless it's an emergency, like people who are sick, who have never stopped from coming into the border. We have never done so. People who have got health emergencies have always been coming in. Those who plan their journey are advised to obtain a 72-hour PCR certificate. Now, when we realize that there are those who could not afford it or who, by some reason or the other, would not have done it, we introduced this antigen test. It was introduced specifically when Lesotho government told us that the Basotho cannot afford the PCR test and they want another means. And the Department of Health immediately rushed to introduce the rapid antigen. It so happened that when they were making this request, the World Health Organization had already pre-qualified an antigen test. And that's why we are offering it to those who may not have a PCR test. But it's an advantage for a traveler to obtain a PCR test before leaving, before starting to travel, because then it will be smoother at the border. They don't have to wait for that antigen test, which can take 15 minutes. So my understanding is that, yes, and my further understanding is that we have given figures of the number of people who will be deployed by the Department of Health. And we've even said further, the National Health Laboratory Services will deploy private providers, that means private laboratories, so that there are ample areas where you can have a test. And of course, at your own cost, when you arrive at the border post. What we will not accept is for people to plead poverty and say, I'm so poor that I cannot afford this test. Of course, poverty is something that is very painful. But unfortunately, the fact are that we cannot allow you in if you don't have that test. Because if you do, then why will anybody else want to produce the test when they know that if you plead poverty, you just don't produce it? We are faced with a situation of war here on COVID-19. Everybody must take their responsibility. And all countries around the world are demanding a COVID-19 test. All of them. I've never heard of any country, unfortunately up to now, that is not doing that. They all do. Even with the congestion at Beit Bridge, Zimbabwe was insisting on a 48-hour, not 72, a test that is no older than 48 hours. We were demanding 72. So it's something that countries do to protect their citizens, and there is nothing else. There's no replacement of that, unfortunately. Thank you very much.
All right, that was the Minister of Home Affairs, Aaron Motsoaledi, just giving us a brief there of all the various issues pertaining to his department in fighting COVID-19. Now, Transport Minister Fikile Mbalula and the Western Cape Transport and Public